Well, while our virtual room is filling up, I'll take the opportunity to say hello to everyone and welcome. My name is Sayward Montague, and I'm the Director of Advocacy with the National Association of Federal Retirees. I'll be your host for this afternoon's live virtual town hall with Nova Scotia election candidates, Tammy Jakeman with the NDP, Barbara Adams with the PC or Progressive Conservative Party, and Minister Kelly Regan with the Liberal Party. I am joining you today from Ottawa, Ontario, and I would like to begin by acknowledging the land from which I'm joining you is the traditional and unceded territories of the Algonquin and Anishinaabe people. I thank them for having cared for this land. Of course, we are meeting virtually today from many locations across Nova Scotia and in Canada. I encourage each of you to take a moment to acknowledge the land from which you're joining today's webinar and to reflect on how we can each move forward in reconciliation and collaboration. Thank you to everyone who's joining us this afternoon, and especially to the provincial parties and the candidates who are here. The webinar that we're hosting today is intended to help us understand where each of these three provincial parties in Nova Scotia stand on the issues of great importance to us, to our members as seniors, and to help you cast your votes on August the 17th. We'll move on to meeting the candidates and then into some housekeeping pieces. So in alphabetical order, today we have Barbara Adams. A physiotherapist since 1984, Barbara dedicated herself to patients and their families. For 18 years, Barbara worked tirelessly for the Nova Scotia Health Authority as a teacher, researcher, and clinician. Barbara has extensive experience in business, values the importance of volunteering, and is a wealth of knowledge in the health sector. She started her own chronic pain clinic in Cole Harbour and became clinical director of physio care at home. Has been health chair for CARP's NS Board and Community Links Advisory Committee and the ethics chair for the Serving Senior Alliance, and was awarded the Governor General's Award for her dedication to the Arthritis Society, to name just a few of her accomplishments. She is deeply concerned about the direction the current business development, healthcare, and education systems are headed. Barbara is ready to take what she's learned and be a strong voice for equal access to high quality education, transportation, and doctors. Welcome, Ms. Adams. Also with us today is Tammy Jakeman with the NDP. Tammy has lived in the Eastern Passage area for 27 years. She's married to her partner, Ron, a lifelong resident of the Eastern Passage area, and together they've raised two amazing kids. She is also a proud military brat. Tammy is an education program assistant with the HRCE, working with students who require additional support outside their academic programming. As a community volunteer, Tammy has worked quietly behind the scenes, helping out where and when needed at the Eastern Passage Legion, the Buffalo Club, and the schools her children attended. Ms. Jakeman, welcome. And also with us is Kelly Regan. Kelly has been representing her community Bedford in the Nova Scotia legislature since 2009. Since then, she has held a variety of cabinet positions and currently serves as the Minister of Community Services, Seniors, and the Minister responsible for the Advisory Council on the Status of Women. Most notably, Kelly had the honor of being appointed Deputy Premier of Nova Scotia in the government led by Premier Ian Rankin. Prior to politics, Kelly received an honors degree from the University of Waterloo's Co-op English program. She's worked as an award-winning television director, producer, and writer. Kelly has lived with her husband, Jeff Regan, in Bedford since 1993, and they have 3 children. Ms. Regan, thank you for joining us. These provincial candidates are joining us today to speak about their campaign platforms and also answer questions about your priorities. This webinar town hall is being hosted by the National Association of Federal Retirees. I'll now ask Michelle Langel, Advocacy Program Officer with Federal Retirees, to make a few remarks on behalf of our volunteers in Nova Scotia. Michelle?
Michelle, I think you're still
I've got it. Thank you.
There we go.
Yeah, thank you, Sayward. As Sayward mentioned, my name is Michelle Langel, and I'm the National Association of Federal Retiree Advocacy Program Officer for Nova Scotia. The Federal Retirees is the largest national advocacy organization representing 165,000 active and retired members of the Federal Public Service, Canadian Armed Forces, Royal Canadian Mounted Police, and retired federally appointed judges, their partners, and survivors. This includes almost 11,500 members living in all parts of Nova Scotia. Warmest welcome to all members and Nova Scotians who have joined today's webinar. Since our beginnings, we federal retirees have advocated to improve the lives of all Canadians in retirement and to protect our members' earned pensions and benefits. Our nonpartisan advocacy work supports secure, healthy, and dignified retirements for federal retirees and all Canadians. The ability to age in place with dignity and security should not depend on your postal code. Canadians of all ages urgently need all levels of government working together on these priorities to ensure home care is available, medications are affordable, communities are accessible, and retirement incomes are secure. We look forward to hearing from each of the candidates today about these very specific priorities. Thank you.
Thank you, Michelle. So before we get started, we have a few instructions to help you make the most of our town hall. Joanne Méron from Federal Retirees will walk us through these. Joanne?
Thanks, Sayward. So first, some of you might have heard this, but this webinar is being recorded and will be emailed to everyone who registered for this town hall later this week. While we share these screenshots, you'll notice the speaker's video box as well. If the box happens to hide some of the images we're sharing, simply minimize it by clicking the line in the top left corner or move it by dragging it with your mouse elsewhere on your screen. To enter or exit full screen viewing on your device, click the button labeled Enter or Exit Full Screen, or it might be replaced with a diagonal arrow depending on your device you're using, and it's still located at the top right-hand corner of your Zoom window. All attendees are in view mode only, which means you'll only be able to see the presenters. If you would like to ask a question during the webinar, click the Q&A button at the bottom of your screen to open the Q&A window. From the Q&A window, you may type your question in the box and click the Send button to submit your question. Note that all questions that we will answer during the webinar will appear above the question box. We'll be answering questions at the end of our presentation, but please type them in as you think of them. I would also like to point out that you can vote on questions that have been submitted by clicking the thumbs up icon. This will help our team understand what you most want to know about from our candidates today. If you see a question you'd like to have answered, please click the thumbs up. The chat option at the bottom of your screen is unavailable, so please be sure to use the Q&A feature to submit your questions. Should you need to leave the webinar at any time, simply click the red leave button at the bottom right corner. Sayward, back to you.
Thank you, Joanne. So with that, let's get started. For today's webinar, each candidate will be given the opportunity to make opening remarks, and we'll then move into the question and answer portion of the town hall. And at the end, each candidate will provide closing remarks. We've randomly selected the speaking order for opening remarks to make it fair, and we will be rotating through this order as we get into our questions and discussion today. Our speaking order will have Kelly Regan with the Liberal Party speaking first, followed by Barbara Adams with the Progressive Conservatives, and finally we will hear from Tammy Jakeman with the NDP. You will each have 2 minutes for your opening remarks. Ms. Regan, I'll turn things over to you now to make your remarks.
Thank you, Sayward. Hello, and thank you everyone for inviting me to participate today. I'm joining you from Mi'kma'ki, which is the traditional land of the Mi'kmaq people. The Liberal Party understands the importance of ensuring older Nova Scotians are central to the conversation when it comes to all aspects of living here in Nova Scotia. You raised the next generation. You own and operate businesses. You participated and often still participate directly in our workforce, and you spend your money at our local businesses. You've spent your lives supporting our province, and we want to support you in return. That's why we removed the requirement for income assistance clients to apply for CPP at age 60. Now they'll see higher CPP monthly payments at age 65. And together we've made great strides through SHIFT, investing in things like the age-friendly grant program, rural transportation, and helping businesses be more welcoming to seniors. We know that COVID hit our older population hard. We know the virus revealed issues in our long-term care system that needed to be addressed. And that's why we've made a commitment of $152.6 million in long-term care that will create 500 new beds and renovate nearly 2,000 existing beds and reduce wait times for placement to 60 days. As well, during our time in government, we've invested in our continuing care sector, and we're furthering that effort by investing more than $1.1 million in the Caregiver Benefit program. We've also improved access to home care services by adjusting the low income threshold for home care, improving access to home care for an additional 1,600 Nova Scotians. Seniors are valuable contributors to our economy and you lead active lives. And that's why we've also committed to investing $8.7 million over the next 4 years to fund initiatives that support Nova Scotia's healthy aging strategy. Finally, I'd like to thank all of you who showed up in droves to get vaccinated against COVID-19. You set a great example. Thank you for believing in science, for following public health directives, and for looking out for your fellow Nova Scotians. I'm looking forward to hearing more today. Thank you.
Thank you, Ms. Regan. Now I welcome Ms. Adams for her opening remarks. Ms. Adams, to you. Oh, you're on mute. There we go.
Hi there. Thank you all very much for having me here. One of the things in healthcare we know is that you have to assess a problem first before you create a solution. And the current government has had 8 years, and we are still waiting for the long-term care strategic plan that in 2015, this government said would be released in 2017. The 5-year plan, and it has not been released yet. So our party came up with strategic plans for the issues that Nova Scotians have been telling us about for the last 8 years. So I want us to be aware of the issues first, and then we'll talk about the solutions. Right now in Nova Scotia, there are almost 200,000 seniors. 60,000 of them are frail. There are 70,000 Nova Scotians without a family doctor, the worst in our history, certainly the worst over the last 8 years. The current strategies are not working, and the minimal investments being made right now and promised are not going to solve the problem that we have. We had 3,600 acute care beds in the hospitals in Nova Scotia. Somewhere 500 of them disappeared. We now only have 3,100. There are 500 seniors who need to be in a long-term care bed who are sitting in those acute care beds, blocking you from being able to get in to get your surgery or to have your acute illness treated. So then when you come to the hospital in an ambulance, you have to sit in the offload area waiting to get offloaded. Then we also have what we call code critical, where this past 4 years has seen unprecedented closures of emergency departments around the province. It's been getting worse every year for the past 4 years, and there's no end in sight. So now what it ends up, and this is long before COVID hit, is we now have the longest wait times in history for orthopedic surgeries, for eye surgeries, for critical things like brain tumors. So we also need to be sure that we have transportation and affordable housing for our seniors. And we've seen the housing stock change not at all for accessible housing, especially that for seniors. And given the fact that we have the oldest population in Canada, we are still not getting health transfer payments that are equivalent to the age of our population. We need a national pharmacare strategy. We also need a dental strategy for seniors in Nova Scotia, because right now, especially in long-term care, they don't get that. So the PC Party has a Hope for Health plan. We have a Dignity for Seniors plan, which I'm very proud to have co-authored, bringing 2,500 new long-term care beds now, 4.1 hours of care per senior per day in long-term care, and a new supported living concept, so that if you're wanting to stay in your community, but not yet ready to move into long-term care, but home care is not doing it for you, then we will add an additional level of home supported living for you. And there are also other initiatives to supply a physician for every single Nova Scotian who doesn't have a doctor. Then we will give you a telemedicine subscription on day one. And we're going to open up the operating rooms around the clock so that people can get the surgeries that they need when they need them.
Thank you, Ms. Adams. We'll move to Ms. Jakeman for your remarks, please.
Hi, good afternoon, everyone. I'd like to begin with land acknowledgement that I am in Mi'kma'ki, and specifically I am on the extended lands of Dwi'tnook, which means the Big Passage. And I will apologize to those watching because I didn't realize that we were starting with policy right off the top. So I thought I'd talk a little bit about who I am and my roots. My name is Tammy Jakeman, and I'm the wife to Ron, who is a retired military service member. He was a vehicle tech, and now he works with Nova Scotia Power as a hydraulics mechanic. We are parents to our adult children, David and Mary, and I've been an educator. I've worked as an education program assistant for 15 years, working with the most amazing kids you will ever have the chance to meet in a junior high school in the Cole Harbour area. I've been a member of CUPE Nova Scotia for 12 years, working as a shop steward, as an occupational health and safety committee member, and as a member of the CUPE National Political Action Committee. I am a proud military brat. My father served 33.5 years with the Royal Canadian Navy as a communicator, retiring in 2001 as the rank of C1 and base chief at CFB Stadacona. In the past, I have been on the executive of the Royal Canadian Legion here in Eastern Passage, which is kind of bittersweet because the branch name is Con Branch 164. And I have a great uncle who died in Normandy after D-Day and is buried in Con, France. And I've volunteered in the past with my children's, the schools that my kids attended, and just helped out on different levels around my community. Thank you.
Thanks, Ms. Jakeman. Obviously, we have three very strong candidates here to talk to us today, so it will be an exciting discussion, I'm sure. We'll now move into the question and answer portion of the town hall. I'll be asking questions that have been prepared by federal retirees, as well as taking questions from the virtual floor from our audience using the Q&A function. So remember to send us your questions using the Q&A panel. If you see a question in our Q&A panel that you'd like to have answered, please remember to click the thumbs up button and we will do our best. Our first question is for Ms. Adams. In the document Dignity for Seniors, the Progressive Conservative Party detailed its plan for seniors' healthcare. While increasing beds, addressing human resources challenges, and developing supportive living are all welcome initiatives, they don't really tackle the aging population's challenges, nor do they address the non-health concerns of older adults or the systemic issues in the long-term care sector. How will the Progressive Conservative Party ensure that seniors have the right care at the right time in the right place so that options are available to meet the needs of Nova Scotia's aging population? Ms. Adams, to you first.
Thank you very much. So number one, the needs of seniors either for home care or long-term care, if they're not met by the province, fall on the family members and the caregivers. And as a guest speaker for Caregivers Nova Scotia, I know that the burden has increasingly fallen on people to where they're now having to leave the workplace to stay home to look after a family member. And home care in the province of Nova Scotia has become less per person over the years instead of more. So what we had, especially during COVID, is we had a different caregiver showing up every time to the home. And the family were having to stay there to educate each new caregiver that showed up. So by having a robust home care system where we have enough CCAs and enough staff in those nursing homes, then the family members can go back to looking after the issues that were in their lives. Another thing that we have to deal with is the fact that 65% of the complaints to the Human Rights Commission are failure to accommodate somebody in the workplace. So these are older adults who have left one job, who are working in another job, but at an older age, where their physical or mental disabilities are not being accommodated in the workplace. And so those are issues that our party is particularly concerned about. Some of the other issues that we would look at is the National Pharmacare Strategy. Right now, there isn't one. And I've met with the Canadian Medical Association, the Canadian Association of Retired Persons, and other national organizations to advocate for this, because if you can't afford your medication, then you were choosing between that and your food or your transportation. One of the things that our party did is we introduced frailty legislation. And the difference between that and an aging strategy is we're looking at what each individual frailty level needs as they age. We're not just talking about those who are in long-term care. We're talking about frailty levels 1, 2, and 3, which is the earliest, highest functional levels, and then providing a strategy in writing in legislation so that we can provide the transportation, the healthcare, and the housing that people need at all frailty levels.
Thank you, Ms. Adams. Ms. Jakeman, we're moving to a question for you and the New Democratic Party. How will the NDP ensure that seniors have the right care at the right time in the right place so that options are available to meet the needs of Nova Scotia's aging population?
Thank you very much. Meeting seniors where they are is really important. Healthcare for seniors is tied to all aspects of their lives, where we live, what foods we can afford and access. And I apologize, I'm like super nervous, folks. In Nova Scotia, the NDP will invest in ensuring that residents have access to the long-term care facilities that they need, ensuring rooms for each person, each washroom, private washrooms for folks, and supporting the CCAs that work with them. Again, really sorry. My nerves are pretty bad here. I'm not quite as experienced as the other two candidates on the call. For the NDP, it's about meeting people where they are. It's ensuring that they have the advocacy. An NDP government will put into place a seniors advocacy group where the voices of seniors will be amplified and the issues that they struggle with will get heard. I probably didn't fully answer the question and I apologize, but I thank you very much.
Thank you, Tammy. Ms. Regan, we have a question for you next. During the Nova Scotia Liberal Party leadership campaign, Mr. Rankin promised to increase investments and modernized healthcare. Can you talk about what exactly this means and how will the Liberal Party ensure that seniors have the right care at the right time in the right place so that options are available to meet the needs of the province's aging population?
Thank you very much. The Rankin government is committed to carrying forward work that's already actually underway at the Department of Health and Wellness to implement the blueprint for change in continuing care. And the vision of this blueprint is to ensure that the continuing care system in Nova Scotia is one where people have the support and the choice to live well in the place they call home by investing in flexible and client-centered care built around diverse family and client needs, by delivering dignified care in modern facilities and environments with stronger and more consistent supports, and by building a skilled and resilient workforce that's representative and respectful of the seniors and the clients that we serve. So we made a number of announcements during this campaign around the skilled workforce issue, about not just attracting doctors, and by the way, there are nearly 80 of them waiting to come in who were delayed by COVID, but also supporting those workers like the CCAs who really are the backbone of our home care system. We will work toward establishing a new model for continuing care where instead of providing funding to a service provider, we'll attach funding directly to Nova Scotians and provide them with more flexibility and choice in the services that, which they require to age in place. Our investments in continuing care are at an all-time high, and this year's budget amounted to over $1 billion annually. This is in addition to the record infrastructure investments announced in 2021 alone that will renovate, replace, or build a total of 2,498 nursing home beds in every region of our province to ensure that when seniors are no longer able to age in their homes, they'll have access to modern long-term care facilities in a timely fashion. And one of the things that I actually really love about what we have committed to is that we will establish a province-wide advisory council of long-term care residents, home care clients, and their families and caregivers to advise on improved policies and procedures for continuing care in Nova Scotia. Nothing about us without us.
Thank you for that. Moving on to our round 2 questions, we'll start with Ms. Jakeman. Will the NDP commit to collaborating with the federal government and provincial territorial counterparts to establish national standards for care in home and long-term care to improve the safety and quality of services for seniors? If so, how will you advance that?
Hi, thanks for the question. Yes, 100% we will make sure that there are standards in place. It's a safety issue, not just for the residents in their long-term care or in their own homes. It's also a safety issue for those, the CCAs, the RNs, the LPNs that are working with those people. And so an NDP government will fully commit to setting in place those standards and making sure that the collaboration at the federal level will happen. It's something that needs to happen all the way around. Things like the pharmacare and dental care, the federal NDP did have Bill C-213, where it was important to have universal pharmacare for people. And so that we are fully committed to ensuring that those conversations happen, because it's actually a cost-saving measure when folks have, when we're being preventative in our healthcare as opposed to reactive, it saves money, because the reactive means that folks end up in medical crisis and there becomes an exponential cost. So it's a cost savings when we work to make those things happen. And
thank you, Ms.
Yes, thank you.
Thank you. We'll move next to Ms. Regan. A few weeks prior to his resignation, former leader of the Nova Scotia Liberal Party, the Honourable Stephen McNeil, stated, "If the federal government is going to provide funding for long-term care, it would make sense that they should know how it's being spent." What is the Liberal Party commitment to advancing national standards for long-term and home care?
Thank you very much. And I just did want to say, Tammy, don't be nervous. You're doing great. So you're showing quite well alongside the seasoned pros, I have to say. What I will say is that we need to be clear here that healthcare is a provincial jurisdiction. And when we do have national standards or national programs, sometimes we do give up some flexibility, some local priorities. But what I can say is we meet regularly with our corresponding federal and provincial and territorial leaders to advance issues of common interest, things like healthcare, things like national standards, that kind of thing. Always we would be putting the interests of Nova Scotia first in any conversation. We want to make sure that if we sign on to anything, it is something that that is good for Nova Scotians. And that would be at the forefront of our minds, whether it's at the health table, whether it's at the seniors table, but we meet regularly with our colleagues from across the country to advance issues of common interest.
Thank you, Ms. Regan. Ms. Adams, last summer, the leader of the Progressive Conservative Party of Nova Scotia sent a letter to Prime Minister Trudeau asking for a commitment to provide funds for the party's Dignity for Our Seniors policy project. While direct agreements between the federal government and individual provinces or territories can be helpful, we need provincial leaders to help implement national standards in long-term care facilities across the whole country. So the question to you is, what is the Conservative Party's commitment to collaborating with federal government and provincial territorial counterparts to advance those national standards in home and long-term care?
Thank you. So our party has already been working towards those national standards already with the organizations that I've already mentioned. When we wrote a letter to the Prime Minister of Canada, the federal government was offering some partnering funds for long-term care that our current government was not taking advantage of. So we put out our long-term care strategic plan on this over a year ago, signaling our willingness to work with all parties across the country. The thing that concerns me is the current government has had 8 years to do this and to demonstrate their willingness to do this. But this current government has failed to complete even the medium or any of the long-term recommendations put out by the long-term care expert panel that was released 3.5 years ago. The Premier admitted to me in the legislature about 3 months ago that they had finally completed the short-term goals, which are very basic, not even meeting minimum standards in terms of staffing levels. So if a current government hasn't created a strategic plan for their own provincial standards in the realm of a strategic plan that they were going to release in 2015, or said in 2015 they were going to release in 2017, then it's difficult for me to believe that future promises will have them working towards a national strategy. But as a physiotherapist, we already introduced legislation to enshrine a provincial strategy, and we put out our plan a year ago. And again, working with the Canadian Medical Association, the Canadian Association of Retired Persons, the Advocacy for the Care of the Elderly, the Nova Scotia Association of Nursing Homes. I've already worked with them. I was part of those stakeholders, and I worked in volunteered at a nursing home in my community for 6 months during the pandemic. So the bottom line is you have to have appropriate staffing levels before you can have appropriate standards, because we can't set excessive standards when we don't have sufficient staffing in long-term care, in home care, in our acute care settings. So in Nova Scotia, we've got 20% short of nurses. We have over 100 doctors missing from the province. We can't set these lofty standards unless we are going to train, retain, and recruit the right number of staff. And the PC party are the only party that have promised to give every single Nova Scotian without a family doctor an immediate subscription to a telemedicine physician. We're going to build those beds that need to be done. We're going to increase the staffing ratio, as all of the unions have asked, to 4.1 hours of care per senior per day. We are the first ones to come out and say that we would do that, because right now in long-term care, 17% of staff get injured on a yearly basis. And that is the highest of any industry. So we have to value our healthcare workers by staffing them properly, by paying them properly, by giving them the equipment that they need, and not making them jump through hoops and applying for things like safety belts and air mattresses that should be standard operating equipment. So we have to start treating our seniors and our staff with respect. And that includes paying them properly and making sure that there are sufficient staff in these facilities to provide the care that they need.
Thank you, Ms. Adams. I was generous with the timing there, so I will provide time for our other two candidates to respond and to have a conversation, if you'd like, on the points that Ms. Adams raised. So Ms. Jakeman, if you'd like to respond first, I'll give each of you and Ms. Regan a minute and 30 seconds to respond.
Thank you very much. I wasn't quite anticipating this. So in the collaboration, and Ms. Adams saying that, you know, her party has spoken out. Actually, labor unions have been speaking out through the NDP at a federal level for much longer about the need for, you know, these standards to exist, the 4.1 care hours, and the you know, respecting CCAs and the work that they do. It's been a call, just for myself as a laborist and with my background with CUPE in the political action movement, to ensure that these things are put in place. And it's been a call for several years. Ms. Adams is right. Workers are getting hurt at an exponential rate, but ensuring that the CCAs are paid adequately, and so that they're not being forced to work at multiple facilities just to make up the hours that they have to survive. And if the wages meet what they need to meet, then those CCAs aren't bouncing around, and then the people are able to be there to provide that work. But the need for a national standard, that actually has been a labor issue for many, many years, and the NDP has been advocating for it at a national level.
Thank you, Ms. Jakeman.
Thank you.
Ms. Regan?
Thank you very much. I would just like to point out that the province is actually investing more than $3.5 million in workplace safety and training equipment for staff in continuing care. It is an area where people do get injured. There's no question about that. So we want to make sure that people understand how to lift properly, etc., and make sure that they have the equipment that they need to lift patients. More than $1 billion was announced in this year's budget to enhance supports for residents and staff in continuing care. And in terms of the issue of wages, in fact, I think we just settled with CCAs and they received raises above the wage pattern for the rest of the healthcare system there. And I would just note that when you have changes in the standards, then that will produce new changes in terms of new investments working to a more modern standard. So you may have come out with a plan in the past, but the new reality has changed what people are looking for. So things like single rooms, safer, more comfortable rooms, historic investments are happening now.
Thank you, Ms. Regan. That was a good exchange. I'll just remind our audience members that the questions you'd like to have answered by the candidates should be coming in through the Q&A. So this is your opportunity to hear from representatives from each of your provincial parties. So please remember to send your questions via that Q&A panel here on Zoom. And if you see that someone submitted a question that you also had brewing in the back of your mind, remember to vote for that question by clicking on the thumbs up icon. We'll now move to a couple of questions that were submitted by our amazing volunteer team from our branches within Nova Scotia. Our first one, in the first one, I'll go through each of the candidates alphabetically by last name. So we'll have Ms. Adams, Ms. Jakeman, and Ms. Regan responding in that order. The first question is from our branches. What will your party do to address the current wait lists for long-term care beds? So Ms. Adams, over to you.
Thank you. Well, having worked in it for 40 years, we put out a strategic plan over a year ago. We're going to build 2,500 new long-term care beds because in 20 years' time, the number of seniors is going to double. That will place everyone who's waiting from home, from hospital, and we even have some people who were in hotel rooms because they didn't even have enough acute care beds. So every single person will have their own single room. We are going to increase the staffing ratio from 4.1 hours to 4.1 hours of care. We are the first party in Nova Scotia to make that commitment in writing. We are also going to ensure that we increase the staffing ratios, and there are a number of strategies for ensuring those staff. We have an inequity in terms of the number of physiotherapists, occupational therapists, rehab therapists in the 133 facilities around the province. And I was part of a white paper that was submitted to all MLAs from long-term care in terms of the inequity in the staffing ratios. So one facility with 100 residents may have a full-time physiotherapist and OT, where another residence with 400 has only a half. We're also going to make sure that the facilities all have the proper equipment that they need, not through applying for grants for safety belts as they just had to do recently. The historic investment in long-term care is only because there was a historic underinvestment and actually a reduction in long-term care funding to the point where a few years ago, we had actually had to make the point that seniors in long-term care were eating on $5 a day, which was less than those living in prison. So these are some of the commitments that we're going to do. We're also going to look at dental coverage for those who are in long-term care, because currently they do not get any dental coverage. There are also other things that need to be looked at in terms of assistive devices and mobility aids for those who are in home care or in long-term care. We're also going to create that middle level of assisted living in the home called community supported living. So when home care is not enough for you, because the maximum is 100 hours a month, which is only about 3.5 hours a day, home care no longer becomes an option to keep you at home, but you don't necessarily want to move into long-term care. So the supported living option would be you living in the community with other seniors with a 24-hour day care with a staffing ratio of 1 to 3, which would help you stay in your community, keep your family doctor, and stay close to your family members, which would reduce the loneliness and keep you close to your community. We're also going to recruit physicians. We're going to be giving them a pension plan, which we are the first ones to introduce that in this province. And we are going to provide other supports to physicians to allow them to come. Right now, for the last 4 years, we have not been able to get the government to tell us exactly how many doctors come to the province each month and how many leave the province each month. But I do know that I am the only constituency in Nova Scotia without a single family doctor, collaborative health center, or mental health services. And that affects the seniors in my community because it's an 1.5-hour bus ride to mental health services. And I know the current government has indicated several times, both the old Minister of Health and the new one as early as 2 months ago during budget debate, that my community does not need a collaborative health center or local mental health services or a family doctor. So these are the things that affect the seniors in my community, and especially those rural areas where they don't have the transportation that they need to get to the exercise class, to get to church, to get to the Legion or to the Lions Club for the social events that are good for our mental well-being.
Thanks, Ms. Adams. I will give equal time to the other candidates to respond. So we were at about 3 minutes for that response. So Ms. Jakeman, the next 3 minutes are yours, and then we'll hear from Ms. Regan.
Okay, thank you very much. So in helping with long-term care, an NDP government, we are fully committed to establishing more beds. I don't have the number in front of me, but I believe we are in the vicinity of needing about 3,500 beds that would be created over the next several years. And you can't just like create more beds, you actually need the staff for that. And so an NDP government will bring our CCAs up to living wages and work with the NSCC to increase the number of seats that those folks can take the courses with. We're going to, again, previous to what I said, work collaboratively with the federal government to ensure that pharmacare and dental care gets put in place universally across the provinces, because this will help alleviate a lot of those other costs. It's an exponential savings. And increasing the care hours to 4.1, and in physician recruitment and working, to ensure that we have all those healthcare providers. An NDP government will also work on physician recruitment, but also better utilizing physician assistants and nurse practitioners and registered nurses. For folks that are military, retired military, the guy on your ship or on your base is your go-to person. And so a retired physician assistant who has that military background is going to be key in helping in this process of, providing those extra people at the long-term care facilities, continuing care facilities. I am in the same constituency as Ms. Adams. And so we have a continuing care facility here where we don't have, a doctor for those folks to visit them in their home. We don't have a doctor for our entire community. She's right. And Ms. Adams has had 4 years to also work on this. I know she's had some committee work. And, but for long-term care, it's investment.
Thank you, Ms. Jakeman. Ms. Regan, we'll move to you. And again, just to reiterate the question, what will your party do to address current wait lists for long-term care beds? You have 3 minutes.
So this year's cumulative commitment of $152.6 million will create new capacity within the system. That's 500 new beds will be added, and that will reduce wait times for placement in long-term care. It's part of the way that will reduce the wait to 60 days. We're also renovating 1,998 existing beds for a total of 2,498 beds. and that's modernized beds across 24 facilities. Most of these would be single rooms with their own washroom. There are some that would be double rooms, and of course we do know that there are couples who do wish to live together in long-term care, and so or close friends. So there would still be some double rooms. Oh, and as I indicated, we'll also establish a province-wide advisory council of long-term care residents, home care clients and their families and caregivers to advise on improved policies and procedures for continuing care in Nova Scotia. And so those are a couple of things that we're doing. We've also, and I just want to remind people that when we talk about virtual care, we have committed to expanding that to people who do not currently have doctors because of the pressure that COVID has put on in terms of doctors immigrating into the province from other jurisdictions. So I do want to be clear that while we are waiting for those physicians to arrive, people will be able to access that, and as well, they will be able to access that service in areas of the province where it's difficult to recruit doctors. It's been a continuing concern for us. We often bring doctors in and they stay for a while, but there are some areas of the province where we have some difficulty. We're also working to help recruit folks throughout the continuing care system, whether it's nurse practitioners or having practical nurses get more training. We're opening up new seats at NSCC to in fact increase training so that we can in fact have more folks trained up, as well as going to the in terms of doctors coming into the province, and we have expanded seats at Dalhousie for more doctors. We've expanded seats for nurses so that we'll have more nurses. We continue to expand all of the pathways into that. And I should, underline for folks that there's also home care is part of the equation too. For many people, they don't want to go into a nursing home, and it's not appropriate for them to go into a nursing home yet. Mm-hmm. So we have expanded the options for home care by adjusting the low-income threshold for home care, which allows people to remain in their homes to receive care. We worked with our federal partners to provide an additional just over $3 million per year for these programs to provide access to home care for an additional 1,600 Nova Scotians per year. And we've also invested $1.1 million to further recognize the important role of caregivers in assisting loved ones and friends with their needs at home. So changes to the Caregiver Benefit program will support those who are providing care to folks at home who have a high level of disability coupled with either mild cognitive impairment or the need for significant support from others to carry out daily activities. And those would be things like medication management, meal preparation, shopping, and banking.
Thank you, Ms. Regan. I really want to move to this question, just change gears just a little bit, but still focusing on long-term care, because that is resonating with our members in our audience. From Ellen in the audience, are you and your party prepared to set up an independent oversight and accountability entity to ensure the safety of seniors and residents, as well as staff in long-term care? I will start with Ms. Regan, Ms. Adams, and Ms. Jakeman, and we'll try to stick to a minute for responses because I do want to make sure we can get to any other questions and some wrap-up remarks. So Ms. Regan, to you, and then we'll have Ms. Adams and Ms. Jakeman.
I want to thank Ellen for that question. I think I know which Ellen that is. And so I did want to reiterate that we've indicated we will establish a province-wide advisory council of long-term care residents, home care clients, and their families and caregivers to advise on improved policies and procedures for continuing care in Nova Scotia. And that does include long-term care. I know we have some very passionate advocates here in the province who have lots of good ideas about how we can better look after our residents in long-term care homes. And I really want to thank them for their passion and their oversight.
Thank you, Ms. Regan. Ms. Adams, to you.
Thank you. So the answer is absolutely yes. Currently, the 133 nursing homes and residential care facilities really don't have any significant oversight. And between the Department of Health and Wellness and the NSHA, it's very difficult to hold the CEO or the higher management staff accountable. So there was an awful lot of grief over the last year and a half with each nursing home doing different things during COVID-19 and different responses to the pandemic, and even different times in which facilities were vaccinated. There were some in certain parts of the province who were vaccinated long before others were done. So absolutely, and part of the frailty legislation that I introduced in the last session of the legislature would commit the PC Party of Nova Scotia to that.
Thank you, Ms. Adams. And Ms. Jakeman.
Thanks. So the NDP, as I think I previously stated, will create a seniors advocacy office where the voices of those seniors and retirees will be heard fully. It will be independent of the government, so no oversight. Those voices will be able to be amplified. There will be transparency and accountability, and it shouldn't be hard to get answers, and folks shouldn't have to wait, and they should be able to get the answers they need as they need them, and in a method that meets them where they are. If there's a hearing impairment, making sure that there's documentation and written word. If there's visual impairments, making sure again that they get the information that they need in the exact format that they need.
Thank you, Ms. Jakeman. We're getting some great questions from our audience. So if we're getting some great questions from our audience. So in the spirit of responding to their interests and needs, we'll do maybe a couple more lightning rounds like this where we have about 1 minute to answer. One of our questions is coming from Charles, and he would like to know more about proposals under discussion by any party to support services aimed at keeping seniors in their own home longer. So he wants some specifics around your plan for home care. That's a big topic to answer in 1 minute, but if you can provide a snapshot of where your parties are at on that issue, I think Charles would appreciate it. I will go from Ms. Adams to Ms. Jakeman and Ms. Regan. Ms. Adams, to you.
Thank you. It's a perfect question because about 36,000 Nova Scotians get home care every year. And what's happened over the last several years is more Nova Scotians got home care, but they actually got fewer hours of care. And so there's too many cancellations on the evenings, weekends, and holidays. The PC Party, including myself, have been calling for the CCA grant registry to be reinstated because that was one of the key recommendations of the long-term care expert panel. So of course, the number one way to deal with the question you asked is for all of the recommendations from the expert panel to be completed. But when the CCA grant registry was in place, they trained 1,000 CCAs a year. But when the Liberals cut the grant 8 years ago, we've undertrained by 500 CCAs every year for the last 8 years. So we would reinstate that until such time as we had enough, which will take us several years. The other thing is we do not have enough physiotherapists or occupational therapists that are going into the homes to provide that care in your home. Those services have actually been cut over the last 15 years. And so we need to be sure that the right healthcare professional, including social workers, psychologists, speech therapists, and dietitians are also able to get into the home.
Thank you, Ms. Adams. Ms. Jakeman?
In terms of home care, there's actually a huge savings, and I think it's been acknowledged by all of us, when seniors are able to stay in their homes. Folks are generally happier and remain healthier longer. So the NDP will establish higher wage floor for continuing care assistance, while also investing in making sure that those seats are available through the NSCC programs. And our caring jobs are green jobs, and ensuring that adequate pay, recognizing the skills for that work is important. We will establish home care wait times with more support that looks at the full logistics of the home care system. So as I said previously, making sure that folks with different impairments, with auditory processing or visual impairments, have the information in a way that meets them where they are.
Thank you. And Ms. Regan, your response before we head to wrap-up remarks.
Okay, the Rankin government will commit to implementing the continuing care blueprint for change to ensure that seniors are provided with as much flexibility and control over the services they require to age in place well. Every senior has unique needs. The CARP Nova Scotia position paper on working together to bring home care home places family-centered home care approaches as their #1 priority, and this is in line with the work that our government has already begun to implement through the Blueprint for Change. The Rankin government will commit to implementing the Blueprint for Change to ensure our home care services are as people-focused as possible. Our government has implemented and expanded the Caregiver Benefit. We're committed to increasing training opportunities for the entire spectrum of the healthcare workforce by investing in the CCA bursary, a pathway to progress for CCAs to train as LPNs in long-term care, additional LPN seats, additional RN seats, additional nurse practitioner educational incentives, and additional seats for doctors at Dalhousie Medical School. And I will just say, we focused a lot on healthcare here. There's also end-of-life care that we have to worry about too. And so we have invested in palliative care beds and hospices and facilities throughout the province. And we will continue our partnership with palliative care advocates and communities to ensure that Nova Scotians are provided dignified and appropriate end-of-life care. And to be quite honest, we have focused a lot, this particular debate, on healthcare issues, but there's a lot more to seniors. And that's why places like CORA and our investment in CORA, which is the Center of Rural Aging and Health down in Middleton, is so important to me. It's a place where seniors can go to gather, to get support, and to have a number of their different needs met. And there's, when I think of the community links and the senior safety programs, the Silver Economy Summit, there's so much more to our seniors than healthcare. Healthcare is a primary focus, obviously, but I just did want to take a moment to say that in addition to all these very important health concerns, I did want to give a shout out to the people who are working in all the other aspects of senior care.
Thank you, Ms. Regan. We'll just move quickly to closing remarks. We will be a little bit past the 2 p.m. mark here on Ottawa time, 3 p.m. In your part of the world, but we will head to wrap-ups now with some closing remarks from our candidates. You'll each have 1 minute to provide your closing remarks. I hesitate to interrupt anyone, of course, but I will ask if we can stick to that 1 minute mark so that we respect your time and our participants. As with our opening remarks, we've randomly selected the speaking order for closing. So our speaking order will have Ms. Adams going first with the Progressive Conservatives, followed by Ms. Jakeman with the NDP, and we'll conclude with Ms. Regan from the Liberal Party. Ms. Adams, over to you. You have 1 minute to make your wrap-up remarks.
Thank you very much. Just like I did for my constituency of Cole Harbour Eastern Passage, as soon as I got elected, I found out that 26% of my constituents did not have a family doctor. And I fixed the problem that we had with the 811 wait list. And I got us our very first clinical nurse practitioner. And now the number without a family doctor in my community is down to 1%. And we are on a path to getting ourselves a collaborative health center and universal mental health services if there is a change in government and the PC party has solutions. We have our Hope for Health plan, our Dignity for Seniors plan, universal mental health plan. We have the better paycheck guarantee. We have a better plan for recruitment of physicians, including a pension plan for them, and we are going to give them back their voices. So we have been collaborating with all of the stakeholders in Nova Scotia. We have been listening, and the PC Party of Nova Scotia has a comprehensive plan to take care of the issues that most Nova Scotians care about.
Thank you, Ms. Adams. Ms. Jakeman, to you.
Thanks. I'm going to do this a little bit personal for a split second. I am dealing with an elderly family member who is going into long-term care because of dementia, and the process is convoluted. It is not a great process. And so being an NDP, New Democratic person, that we are going to put into place the Seniors Advocacy Office, where it's going to amplify those voices, where my mom, who is a senior, helping her older sister, get into a long-term care facility is going to make this process better and easier for all Nova Scotians. Thank you.
Thank you, Ms. Jakeman. Ms. Regan, to you.
Thank you very much, Sayward, and thank you for allowing me to be part of today's forum, focusing on how we can better serve Nova Scotia's seniors and retirees. I believe our Liberal government's record shows we recognize our older population is a vital part of Nova Scotia. And as Minister of Seniors, I've worked diligently to make sure you had a seat at the table to ensure your voices were heard on issues that matter most to you. Now, at the start, I mentioned SHIFT, long-term care, continuing care, and our economy as important parts of how we serve and can better serve older Nova Scotians, but we can always improve. Events like this are so valuable in both communicating what we've achieved and also learning more about what our senior population needs. So I look forward to continuing these discussions in the future. Thank you so much for letting me be part of this event today. Thank you.
Thank you all of the candidates today and took time off of your busy schedules to have this session with our members. That is all we have time for today. I'll invite Michelle Langle on behalf of federal retirees to make our closing remarks. Michelle, to you.
Okay, thanks again to all the candidates for taking the time to speak with us and answer our questions today. A lot of richness here in the discussions. And also thank you to all of our federal retirees and any others who have joined us today. Be sure to check your email for a recording of this virtual town hall and check out our website at www.federalretirees.ca for more information about the Nova Scotia election, including key priorities and questions that you can ask your local candidates. We know that many of you had questions that we just couldn't get to in the time we had for today's event. That's why we encourage each of you to take the time to connect with your local candidates to get answers to the questions that are the most important to you. You can find a list of your local candidates at electionsnovascotia.ca, and you can also find information there on when and how to vote. Contact information for the candidates is on each of their party websites. Thank you once again.